Hello again. My name is Brihuega. I'm a VP of Technology at Globant. I will be your host today. Some housekeeping issues to consider. Please write down any questions you may have in the Q&A window here, and we will answer them at the end of the presentation. Let's begin. These days bring changes in technology by the minute, affecting and disrupting all industries, including healthcare. Not only does this imply that companies need to focus on technology adoption, but also these changes trigger new consumer behaviors. Users are becoming more demanding and more aware of the influence of technology, and organizations need to adapt to these changes. Join us as we consider technology adoption challenges, patient-centric care, and interoperability in the healthcare industry. Let me introduce you to Luis Paolini. Luis is our first speaker. He's a digital and innovation manager of Novartis Argentina and Uruguay, and assistant professor of technology architecture at Buenos Aires Technology Institute. He works several companies in the pharmaceutical industry, such as GlaxoSmith and AbbVie, in different roles like business development and IT. Hello, Luis.
Diego, it's a great pleasure to be here, and thank you very much for inviting me. Okay, should I start then?
Yes, please.
Okay, so I'm sharing my screen now. There we go. Can you all see my screen? Yes? Thumbs up?
Perfect.
Nice, thank you. Well, so again, let me thanks Globant for the invitation. It's a great pleasure to be here, and well, so all the attendees, I hope I can give you a 10,000 feet view on digital and healthcare, right? So a little bit more about me, to adding to what Diego just said. I am right now the digital innovation. I like to call myself facilitator to my team. And what I do basically in my daily work is I bring new ways of working and solutions to problems. Yes. I have a degree both in business and IT. I've been working in both business and IT for a few years. I am a developer by choice, thanks to my work in several startups, and I am a data nerd. I always like to bring data to the table whenever there's a discussion. I'm also a university professor in technology architecture. And what I did in the past was working in both IT, business development, product manager, a bit of operations, business operations, both small and medium companies and multinationals. If you want to follow me, that's my Twitter account and also my LinkedIn account. If you want to send me a message or connect with me, feel free to do it. Let's talk a bit about Novartis. Novartis is a huge multinational pharma company. We are valued around $200 billion. It's based in Basel, in Switzerland, and we are one of the top 5 pharma companies. 2017, we had a revenue of around 50 million. I like to call Novartis, it's also a huge company, but it's also 4 companies in one, because we have Alcon, Sandoz, Novartis Pharma, and Novartis Oncology. Alcon right now is being spinned off, but we are still lots of companies in one, and there are also many others because of acquisitions that are still aside, developing their products, but we are in the process of merging them. What are the top products that we have right now? It's multiple sclerosis, autoimmune diseases, macular degeneration, oncology. We have a huge unity in oncology that works apart, and right now the focus, and we have a very good product on migraine. We are around 130,000 employees around the world, and there you have the Swiss flag and one picture about the headquarters. And it's very beautiful. If you are around Basel, go ahead and pay a visit, because it's really beautiful. So what about Argentina? I'm based in Argentina. Argentina is considered one of the most innovative countries around the world for Novartis. This is amazing, really, to have this categorization. And why we are innovative? First of all, the star. It's because we are a tier 1 country for research and development. This means that whenever there is any research study, any clinical trial, Basel headquarters has to ask Argentina first. this is amazing, right? Because we are right now the main, the top one laboratory when it comes to clinical studies in Argentina. We are around 590 employees here, and these are a few numbers. Another amazing thing that we have is that we have one of the 4 forestry projects around the world here in the province of Entre Rios in Argentina. It's 3,400 acre piece of land that it's to reduce the carbon footprint that Novartis has around the world. It's amazing, really, what we have. It's truly amazing. And that's a couple of figures that you can see, but I would like to move forward in what do we do and what are the problems, right? So I've been asked here to talk about the challenges that we have, and let me tell you that we have many, and these are just a couple of them, because there are, I am sure, lots and lots of problems in pieces of the company and many processes that I really don't know about, like how a molecule is built, or maybe how a biologic is made. So there are lots and lots of other problems that I really don't know about them, because I am not in that part. But let me tell you what are the problems, the big problems that we have in the pieces that I manage. So the first one is, it's a data problem. it's what the comparison between what we get in the clinical studies and what we find out once we put that treatment into public, right? So the clinical studies have a very, let's say, depending on the disease, has a very low N. I mean, many really a reduced number of people that try the treatment. But once we put that treatment into the public, there are millions of people, and that's a huge difference, huge difference. And that brings a lot of questions, like why can we extrapolate one to other, and many other things about management and very basically these studies about pharmacoeconomics. The second problem that we are facing right now is, once we get a treatment to the public, well, that's something that happens, and when you go to get that treatment, you get a reimbursement from your payer. So right now, it's a, let's say, a reimburse always scheme versus a reimburse for performance. Like, what happens if you get a disease that the treatment costs really a lot of money, and your payer says that they cannot afford that. So right now, Novartis in some parts of the world is saying, look, let's do the following. You reimburse the money if the treatment works. And that brings a huge amount of issues to Novartis. Like, how can we get the data? I mean, how can we go and say, hey, I need to know all the points in time where this patient has improved or not, so I can discuss with you, I mean, that I need the reimbursement, right? So it's a huge amount of issues that these new schemes or of drugs, gene therapy, or maybe CAR T, or what, really complex medicines that we are doing, how we push forward with these new schemes. The third one, and this is a huge problem for the CEO of Novartis that came here last week to Argentina, is how we build therapeutic platforms. Yes, the pharmaceutical industry has been selling pills and treatments for, I don't know, maybe it's creation. And right now, it's not only pills, it's how we build the customer experience, the whole customer experience. So how do we sell the solution or the therapeutic platform from how you get diagnosed to post-treatment? It's a huge amount of effort that we need to see how we solve these kinds of problems. Other problem is how we shape the environment for the universal coverage. I mean, how do we democratize technology in order to put resources where we need them most? Like what we are doing with Globant in this case, that it's a smart passive platform. I mean, how do we build an application that we can put into the hands of the physicians, and this application can be taken into anywhere, any country in the world, and they can scan for a disease or for something on their skin, and the application gives the best quality of diagnose that the application can bring, right? Compared to the best experts in the world. It's about giving universal coverage. Another one, pharmaceutical industry, as you can imagine, it's a very, very complex industry when it comes to what we need to do in compliance. Yes, lots of papers, presentations. We have really very strong compliance processes, and we need to see how we handle them. So we put the resources internally where we need the most. So how we can do something automatic, like we are doing with Watson Approver. Basically, we developed a bot that answers your compliance questions here internally, and we put the people that are working right now in compliance doing something different, doing something that gives most values. Another problem, huge, in 2020, next year, the United States Ministry of Health said that the medical knowledge is going to duplicate every 73 days, right? So it's a huge amount of knowledge that humanity is generating. And here comes another problem. How do we put all that knowledge into the hands of the physicians? You can go to a physician right now and he can treat you with maybe a treatment that is old. How can we put the best of knowledge into all of the physicians' hands so they can be trained? And the last, and the one that I love most because I am a huge data nerd, it's about the incredibly vast, huge and sensitive amounts of data that we are generating. And the issue with this is that the data is unstructured, I mean, by nature. How can we pull all the info from images, what pill have you taken, what's your adherence to the treatment? I mean, everything that we generate with wearables, with applications, anything. And we can put it into the place where anyone can go there and see what is going on and building algorithms and technology for enhancing current treatments. So before closing my part, and this is something that we are really proud of right now in Novartis, it's Novartis Biome. This is as we did previously in Novartis with opening, like for research scientists or anyone, our whole book of molecules and a library of molecules, so you could come and you could research molecules with us. We have right now a digital innovation lab. It's basically an accelerator. This is an accelerator that is worldwide. And so just before closing, if you have any kind of idea, any kind of new thing that you would like to show us, that we can solve a problem internally in Novartis, feel free to contact me, feel free to contact anyone in Novartis that is related to Biome, and we'll work with you to see how we can solve today's problems. I pass the ball right now to Diego, and thank you very much for this opportunity.
Okay, thank you very much, Luis. Our next topic is looking at how technology plays a role in patient-centric care. And we have Neal Farrand, a technical director at Globant that has over 20 years of experience leveraging technology to aid pharma and healthcare companies. Neal?
Hey, Diego, thanks. So, yeah, so we're going to switch gears a little bit. So we talked a little bit about pharma. So we're going to cover now more on the healthcare side. And for this topic, for the next few minutes, we're going to look at the patient-centric healthcare. So as Diego had mentioned, my name is Neal Farrand. I'm a senior digital architect with Globant, and I have quite a bit of experience working with technology in big pharma, also within healthcare, building products that helped work with patients, with providers, with payers, kind of across the whole spectrum. But as we kind of look at the patient aspect of this, just a little bit about me. So I'm in the United States. I live in the Raleigh-Durham area, have access to some great healthcare providers here with Duke University of North Carolina, and Wake Med, and others. But from a personal perspective, I have a family of 6, so have had the fortunate or unfortunate opportunities to leverage healthcare quite a bit and experience it from a patient perspective. So as we look at this, first thing I want to do is kind of define what is, kind of this patient-centric healthcare. Why are we talking about it? and what's different. So this concept has been around for quite some time, but really as you think about the patient-centric healthcare, as it's kind of defined, I really want to highlight that it's really a partnership that's created between the provider and the patient as they're walking through their patient journey, and really kind of taking into account holistically everything about them, like their emotional state, mental, social, and financial aspects of that. But really want to stress this partnership relationship with the provider and the patient. The reason for this is really kind of the shift, similar to what we heard from Louise a little bit on the pharma side, where they're looking holistically as well, not just about providing pills to patients, but making sure that it's actually treating them for the issues that they have. Similar here, there's several things kind of coming together, one of which is this value-based care, which is similar to what Louise was describing from a pharma perspective, is really shifting from just paying for procedures that are done to help isolate and treat a situation you might have as a patient, but looking to really help us be healthy and valuing that, paying for that. So payments really tied to the quality of care, not just the quantity or all the things that are done. That's kind of one thing that's happening in the industry as we're shifting to this, especially in the United States. Another part of this, and again, Louise, you kind of talked about this, is the information explosion. So there's tons and tons of data out there from science, research, to education for the doctors. And in this case, as we think about from a patient perspective, there's a lot of information for us as patients that are available on the internet that and many times can be conflicting or confusing to us. And so that's something that we have to deal with as a patient. And then finally, and there's many others, but the other one I kind of highlight here is the high deductible health plans are also kind of creating an environment where we see and are exposed to some of the costs. If I want to go to a doctor for a visit, I might feel the full burden of that because of the high deductible plan. So that kind of opens up more questions, more perceived out-of-pocket expenses that are now visible to the patient. Now, what does this kind of look like? So patient-centric healthcare is really thinking about the caregivers interfacing more directly with the patient, being patient-focused, building that connection, that rapport with the patient, kind of understanding more about them. It's not just, we're not just problems and they're looking for diagnoses and treatments for those problems, but really understanding who we are and looking out for our well-being overall, kind of more holistically. And because of that, if you look at some of the benefits or potential benefits that come from this is, you know, obviously clear communication with patients as you bring them into the conversation around the problems that they're facing with their health. And through that, it's a more engaged environment and more appropriately informed. And what I mean by appropriately informed is not just stuff I can get off the internet, but through my caregiver and my provider giving me pertinent information based on where I am with my treatment and diagnoses and things like that. Which leads to kind of improved patient experience because now I'm more engaged in that process and I feel valued as a person and as a patient. Which leads to then better patient outcomes and then finally increased reimbursement. So as you think about the landscape of healthcare, I think first of the healthcare actors out there. We've got all these different actors, which by the way, you know, I'm thankful for all of the different industries and groups that are part of the healthcare environment, from the providers that are out there to the payers to pharma, medical devices, and even government have their role. And they provide some phenomenal services and have done some amazing things with the advancements of healthcare. But when I look at myself as that patient there in the middle, there are a lot of times where I can be overwhelmed and feel kind of pulled apart and disconnected and confused where to go, who to talk to, who's really kind of helping me through all this as a patient. Because in essence, these different groups, and I summarized them at a high level, are kind of not necessarily working together, you know, hand in hand as me as a patient through all the challenges I have. So as we think about that, the next thing I think of is like, as a patient, what is like a patient journey? we really like to, at Globant, we really like to look at kind of the user and the journeys that they take. We talk a lot about journeys. Here I was thinking about the patient journey. And so we're all familiar as patients what we go through. So I won't go into great detail here, but you've got some sort of problem. You're not sure. Maybe you need to go to the doctor. Maybe you've got something even more serious. You need to go to the emergency room or an ambulatory situation, but there's some sort of problem. I need some help. I'm looking for a diagnosis, so I get in contact with some sort of health provider for a diagnosis, which leads to a treatment and follow-up care. And then there's payment, of course, for those services. And then finally, the ongoing management of that treatment. And that's great. That's like one point in time where we might be going through an acute situation or some problem that we might have. But I put an arrow there that kind of reiterates this journey that we go through over and over as we deal with different problems through our lifestyle or through our life. So with that in mind, kind of thinking at it from a patient, and I've had all these thoughts, I'm sure a lot of you have as well, as you start thinking about all these different questions around how am I going to get treated? Who should I go to? Do I go to the internet and maybe go to see what kind of information is available out there? But if I do that, maybe last time I did that, I misdiagnosed myself and took something that I shouldn't or whatever. You know, which doctor should I go see? Is the doctor going to be available? Can I get in when I need to get in? Should I get a second opinion on something? Maybe I've gotten a diagnosis from a doctor and I'm not sure. So all these questions are kind of circling around in our heads as we're trying to figure out for ourselves and our families, you know, what the best decisions are. And it can be very disjointed, very confusing. Which leads us then to opportunities. So with all of those needs and confusion that's out there on the left, that leads us to some specific opportunities that we're going to move towards in the technology space. So if you think about guided healthcare, you know, helping me as a patient understand if I'm sick, am I normal, what's going on, who should I see, when should I see them, how, if I maybe have a chronic situation, how do I handle that chronic condition, you know, should I get second opinions and so forth. You know, just helping guide through all of this noise that's out there, which is somewhat related to the patient education. But when I think about patient education, I think about taking into account, you know, the ways that I learn best, you know, or maybe I've got some disabilities or limitations in my ability to get out of the house or read or, you know, whatever it may be. So when we think about kind of patient-centric healthcare, taking those limitations into account and providing information and education that is conducive for the way I need to learn and make it easily available. On the personalized care and alerts, so creating health plans that are partnered with the patient and the provider that takes into account my needs and maybe my preferences and goals of what I'm striving to do from a health perspective. And these goals then can be shared with a broader team of care across the continuum of that patient journey we just talked about. From a health records perspective, you know, having access to those records, who knows what about me? Right now, they're all kind of disconnected and disjointed, but, you know, I want to be able to see my health records, maybe update things myself into those records to collate all that information about me and then be able to share what I want to share with others. On the provider availability, looking at, you know, when patients or when providers are available, who do I see, when can I see them? And then finally, projected treatment costs. All these things cost money. You know, as a partner in my health as a patient, you know, understanding what my options are and what the costs are associated with them. And as we look at those needs and opportunities, that leads us to then some technological solutions. And at this level, I'm going to go at a high level. My colleague, Patrick, next is going to go into a little bit more detail in some of these. So this was just kind of meant to be kind of a high level. But as we think about patient-centric kind of technologies and solutions, many of these people are working on. Some of them are out there, some can be improved. But we've got things like a provider finder that works well, you know, across networks and helps me, you know, find the providers that make sense for the problems that I have. Or check-in services, you know, thinking about how I get connected to the provider, check in immediately, understanding my costs. Over to the left, looking at like chatbot services. Luis talked a little bit about this in the pharma space, but helping triage and guide me through my healthcare. On the application side, we've done some things, and there's lots of opportunities for gamification, for really understanding where we are with our health. Maybe there's some sensitive things around depression or other things that are hard to diagnose sometimes, and how can gamification and applications help the provider understand some of my needs that I might not be able to communicate very clearly. Provider communication, just constant communication with the provider as they're caring for me in this journey, and so forth. Smart pill dispensers, telemedicine is a big thing that's coming out that helps certainly in the rural areas connect patients to doctors, but it also opens up doors for allowing for me to ask questions with things that come up that I'm not even sure if I need to see a doctor. So there's lots of applications with telemedicine. There's non-technological things like urgent care centers popping up more all over the place that gives us more access to providers that have been very helpful. And just a couple other I'll highlight. The smart devices, there's tons of them out there, but leveraging those smart devices in the way that I want them to work for me, and maybe even connected so that I can set goals and allow for monitoring of my health and certainly any alerts that may come up that would be a good indication I might need to go see a doctor. And finally, on the charting side there, these personalized treatment plans, that we put together with the doctor, really understanding what the goals and objectives are with these treatment plans. And finally, the data aspect of this, these health records that are really right now spread out all over the place. This interoperability of data problem that Patrick's really going to go into much more detail. So in closing, I always like to look at, those are some of the opportunities if you kind of envision what's going on now and kind of envision a world where some of these are more connected, where we can track patients, track my patient encounters with the various providers, track and monitor the personalized treatment plans, understand the cost and how that's working for or against me. Just really having more of involvement in that and understand what's happening as these technologies work together. But we also have some real challenges and blockers that are, I think, out there that are real that we need to work against. And the first that comes to mind is really the privacy and security concerns, and rightfully so. There's numerous vulnerabilities, it seems like every week, that are coming out with technology companies that have our data. And so there's a real concern as patients of who has my information, who am I sharing that information with, and how secure is that, who has access to it. There's some certain tension there of, on one hand, I would love as a patient to see all my information collected together. On the other hand, I have some concerns with that with some organization, having all of my data. So there's definitely challenges there. We've got regulations that governments are establishing that in some ways work for us, in some ways work against us in what we're trying to, as you think about it from a patient perspective. Consumerism. There's this thought, as you think about patient-centric, are we actual consumers in this world? And I would say no, we're not necessarily a consumer, although, again, I want to be treated with respect. But as a consumer, I can tell my phone, I can set up my phone exactly how I want it. But as a patient, I am looking to the providers for, thought and how to treat and diagnose. They're the experts in that. I am not, clearly. And so, consumerism can go a little too far, I think. And we have to remember that we are a patient. We're not necessarily a consumer. There's profit challenges as we shift from a fee-based to value-based type thing. Doctors, I interviewed several doctors as I prepared for this. Doctors are still measured with the number of the volume of patients that they see because they still need to make money and have a business. The drug companies and everything, these are businesses that are looking to make money. So that's kind of reality and needs to be addressed. And then finally, a lot of these systems are closed. In the healthcare world, they're not really set up to talk and communicate very easily. A lot of that's purposeful, so that's a real challenge. And then at the provider level, we have a lot of handoffs, and the handoffs can be expensive and challenging. It's difficult for communication, and the patient's kind of stuck in the middle. But the reality is there's no one provider that can handle all of our treatment plan. So that's a reality. So really, those are some of the blockers that we have as we look at some of the technological advances that are happening and are continuing to happen for the patient.
Thank you, Neal. And now we have Patrick. Patrick is a senior consultant at Globant, currently working in a project in technology advancement division of a US-based player. He's helping them to make use of cutting-edge technology to transform healthcare. Patrick?
Sorry about that. Ended up locking my computer when I was trying to undo things here. Hi, good afternoon and welcome. We looked at the list of people who are attending today, and we got a very wide range of people on this webinar, from developers to physicians, doctors, CEOs, CIOs. It's a very wide range. So it can always be a challenge to address such a wide audience in a format such as this. So I've got two goals in mind today. First is I'm hoping not to put you to sleep, which can always be an important goal for a presenter, and then to also give you something that might be helpful to you in your day-to-day business and maybe spark a conversation with us as we move forward. I'm going to be discussing healthcare interoperability today, and that seems like, looking at the question and answer sessions during Luis's and Neal's presentations, there's a lot of questions around interoperability, Fire, HL7 blockchain, which I'm going to be addressing in this presentation. And I'm hoping that all of you are going to be able to go away from here with a better understanding of what interoperability is, what some of the opportunities are, as well as some of the challenges. For a working definition of what interoperability is, I want to point out how HIMSS is currently defining it. And this is a working definition. They're looking for feedback, so if you don't like it, please go to that link, and you can feel free to discuss that with them. For me, the key elements that are in here are to connect, share, and use information to improve healthcare. HIPAA has put kind of a wet blanket on many of the things we do here in the States and probably elsewhere, but many of the organizations are trying to encourage the conversations and trying to encourage the interoperability taking place here. And indeed, connecting this with Neal's presentation a few minutes ago, one survey showed that 70% of providers say that interoperability, data sharing in particular, is absolutely necessary for the value-based healthcare that he was talking about. If we want to get to value-based healthcare and have outcome-based payments rather than just fee-for-service, we're going to have better data being passed back and forth. Some people may be saying, why are we talking about interoperability now? States have been setting up healthcare information exchanges for years, and electronic health records have the ability to export and import data. Don't we have that already today? I would say that we don't. Not in the way that this definition intends, and not in the way that the government and many of the payers and providers are trying to intend. I had to move a few years ago to take my current position here, and I had to go back to all the doctors I'd been to before to get all my records transferred from one doctor's office to my current doctor. The steps were almost always the same. Go to the website, find the right form, download it, realize I don't have a fax machine anymore, call the doctor's office, find out who I need to send this email to, send it to them. And then when the doctor gets the request, they pull my records, print them off, or copy them out of the paper records, and then fax them over to the new doctor's office. Then that new doctor's office has to scan those records in if they deem them important enough, and it is then in my electronic health record as an image that probably no one's ever going to look at. Those are hardly cutting-edge technologies or hardly cutting-edge interoperability here. We have been doing interoperability and setting the stage for interoperability for years now. Now it's time for us to move forward. Where the past has been focused on creating the ways to share the information and the data, where now the current trend is to become far more patient-focused. The CEO of Humana put it this way in one of his posts on LinkedIn. He's trying to make it better, easier, secure, more real-time to interact with payers, which is one of the questions people asked. The payers are trying to reduce this friction with the providers as well to speed things up, to make it less complex. And he sees interoperability as one of those key factors here. As I said, we've been setting up the groundwork in interoperability for quite a few years. Now it's time for us to start using it. start using it. Here in the United States, the Centers for Medicare and Medicaid Services, their administrator, Seema Verma, put this out there just this last year in March. She's trying to make it even clearer. We need to empower consumers, make this patient-centric, as Neal was saying, give them the ability to access their healthcare data. CMS themselves has been doing this for several years with their Blue Button API, which makes 4 years of past claims data, no matter which doctor you went to, 4 years of claims data available to the end user via an easy-to-use API. Now, most people can't use an API to pull that data out and get that information, so we need to find ways that we can use the data that CMS is providing in a way that end users can make use of this data. These are the kind of APIs that are going to transform how we connect, share, and use data in the healthcare system. Another API or system that has changed the face of healthcare, or I think is going to change the face of healthcare dramatically, is Apple Health. Apple Health gives the consumer the ability to download and have their entire healthcare record at their fingertips. 90% of the people who have used this say that this has improved their understanding of their own health and facilitated conversations with their doctors, and make this easy to share data with other people, to make this so that they can be part of the conversation rather than just a recipient of the conversation. If you've never seen the Apple Health record, this is the kind of thing that it looks like. It gives you access to all kinds of records. I mean, I've got 467 here. This is my healthcare record. I've got 467 records here, including all the different immunizations I've gotten, all the different lab results. And if I were to click on any of those lab results, I'd be able to see, or my vitals, I'd be able to see how those changed over time via charted. This is the kind of thing that's empowering end users and the consumers with the information they need to ask more informed questions and to take part in the healthcare decision making. Many providers have mobile apps or websites which connect with their electronic health records, like Epic's MyChart, one of the ones I'm most familiar with. But I bring up Apple here in particular. Globant didn't have anything to do with the Apple Health thing, but I bring them up to address one key point. By putting our healthcare records in our hands, Apple has set the bar for other providers to participate. Users are going to get used to the idea of having access to their healthcare records in one place and demand it everywhere. That's the kind of thing Apple's been known for, where they come in and just make this slight little thing that seems obvious to everyone else and completely transform the industry in many ways. And I'm hoping Apple succeeds here, because I want this same level of interoperability and ease of use everywhere with every doctor I go to. Now, a project that Globant did work on was an interoperability project within a physician's office, and Neal alluded to this. We worked with LabCore to create a system where the patient, instead of going in and signing their name on a clipboard and sitting down and waiting for the receptionist to call you back up and ask you questions, they can just go in and scan their ID cards, their driver's licenses, whatever ID card they have, or a QR code that they're given, and then they can answer questions on a tablet that's in front of them. No more filling out those paperworks. And this just makes it faster and easier for the patient check-in process, both for the patient and for the office staff. And anytime you make it faster and easier, that means it probably makes it cheaper as well. Imagine extending the same idea to have patients fill out all those interminable questionnaires and paperwork you get every time you go to the doctor's office here in the States, with a tablet that they use while waiting on the doctor to come into the waiting room, or to come into the treatment room that you're sitting in, or providing education about what might be happening later that day. Anything is better than having a 3-year-old copy of that Christmas edition of Better Homes and Gardens that's been paid through years and years. Much of this has been driven by HL7 Fire, and someone asked a question about this. HL7 Fire is an implementation data standard that the HL7 organization has come out with, and Fire, if you're not familiar with it, stands for Fast Healthcare Interoperability Resources. It's a data standard that they've been quietly perfecting over the years, or trying to perfect over the years, and the first ready for trial use version of this came out, or ready for use came out in just this last year. So we're still on the cutting edge of things. And Fire has ushered in a new era of interoperability with changing the way that we used to do things. The old ways of doing things I'm going to get real technical here for a second. The old ways of doing things with clinical document architectures with very complex XML documents being transmitted back and forth via SOAP protocols, that is challenging and very difficult, and often that code doesn't age well. Now with the FHIR standards, they've got many ways of interacting with FHIR standards, from flat file interchanges to JSON interchanges. For the developer, parsing a JSON object is far simpler than dealing with XML. So this is going to speed up implementation and make it far easier to develop new standards and new applications and new tools. But if you've worked with FHIR implementations, as I have, you'll know that just because there's a standard doesn't mean that everyone uses it exactly the same way. One implementation of FHIR may not code the same encounter the same way as another one does. They may try to shoehorn or a user of this implementation may try to shoehorn a piece of data in that they can't find where it ought to fit, and someone else may put it in a different place. And so you end up with multiple different ways of even using this data standard that we've got. And so FHIR has been helpful, but it's not been perfect. And so there have been a number of different initiatives that have taken place here, specifically the Argonaut one in the lower right-hand corner. Project Argonaut was a commitment by several of the stakeholders in the industry to provide funding, political backbone, and a determination to actually implement these FHIR standards. And it is Project Argonaut which helped Apple to create the Apple Health app. And so I see that this Project Argonaut and Smart on FHIR, which is also part of this, will be a major force in driving the way that we interact with data and the way that we build things in a standard way. One of the latest technologies that's also been really transforming things is, and someone mentioned this in a question earlier on the Q&A session, is blockchain. What do we do about blockchain? We've heard so much about this. Will blockchain save the healthcare system? Neal mentioned this. Trying to find a provider here in the States can be very challenging. There are all kinds of errors when you go to your insurance carrier's website to try and find a doctor. They may have the wrong information. They may have incorrect addresses. They may have moved. New doctors came in. Old doctors left. All this information gets very jumbled in these systems, and you can end up with lots of records and that have incorrect data. One group I worked with said that up to 60% of the data in some of these systems in some areas is wrong, which is downright scary when people are trying to find a doctor. In order to fix these things, the doctor's office has to call up the insurance carrier, tell them that something's wrong. They have to go out there and fix it, which takes time, which takes money. So this is something that can be very valuable for these people, and they're trying these things out. This was just announced, what, 2 weeks ago, to use blockchain to try and fix some of these errors in provider directories and to lower the cost of keeping that information up to date. So for some people, blockchain seems to be the answer for all kinds of healthcare issues. So this particular one could be a very good case for blockchain to keep this information up to date and to share it. So some people may be asking, what is blockchain? Blockchain basically has three essential elements. It's got a distributed ledger, which I'll talk about in a minute, a consensus algorithm, how we say that the data that is on there, everyone agrees that that is the data that should have been put on there and that is correct. And then there's also a currency associated with it, or a cryptocurrency. Now, each one of these things can take place, but I'm going to talk specifically about private blockchains or distributed ledgers here today, because adding in cryptocurrency and adding in the consensus algorithm, which includes what you've heard about mining with blockchain, taking up so much electricity and a lot of other things, those just add a layer of complexity on top of blockchain, which may not be necessary for some of these things. So the distributed ledger, in a very basic idea, is you have multiple copies of a piece of data, of this ledger, of this data. All the different companies and groups that participate in this have access to that data and can be kept in sync via a centralized mechanism. Each of the participants, as I said, has a copy and can make changes to their own copies, which then get distributed to the other ledgers, and they can be added on as a new block when enough of the participants agree that this is the case. Now, one of the security concerns people have about this is, well, we don't want to have all this data on a blockchain publicly available. It doesn't necessarily need to be publicly available. It could be just a pointer to someone else's record. So if you need to get my healthcare record from this type of provider, they can go in there and say, okay, I need you to go to this doctor's office and get this data. Here's the Fire interface access code. You need to get that. You can go out there, get that back, and make use of it. Using a distributed ledger in this way means you could remove the mining and all its challenges, as well as the cryptocurrency, which just adds a layer of complexity. You still get the benefits of blockchain, an immutable, updatable record of changes over time that everyone agrees on and can trust. Private blockchains or distributed ledgers have inherent challenges, especially when integrating with existing platforms. Issuing and maintaining X509 certificates, adding a new participant into the blockchain, managing a complex platform which is constantly changing because they're constantly improving it as it's being developed. All of these things can really increase your operational costs. But blockchains and distributed ledgers have their places. They're not a panacea for sure, but they are worth exploring. Even the process of exploring and thinking through how you might implement a distributed ledger or blockchain can get people thinking about how they can really make improvements in their own existing systems. So in conclusion, we're going into a time where interoperability is going to take on a lot more urgency. If you have to do integration, I would encourage you to get in touch with any of the three of us here, or any of the people from this webinar, or want to explore blockchain, integration or blockchain. We'd love to talk to you more about it. Thank you very much.
Thank you very much, Patrick. Thanks once again to all the speakers for the relevant and fascinating presentation. We will move on to the Q&A section. We have tons of questions. We will only be able to address a couple of them, but feel free to send us an email or post it on the blogs or anything, and we will try to answer the rest of them afterwards. So let's see. I have a question here saying, how you see chatbot and automatic recommendations versus regulations from healthcare market? Anyone in the panel wants to take this one?
I can give a couple of comments about that. So I truly believe that the regulations always come after the technology is developed. So my opinion there is that really we need to do something about lowering the burden for the patients, easing the work of physicians. And the only answer I see to that is technology. Yes, there are regulations. We need to comply with all of them. It's our duty. But regulations will come in the future. Before that, we can do everything. There are many chatbots with like closed answers that are compliant right now, and that's perfectly normal. It's my opinion. I believe that Novartis is doing that thing around the world in many countries.
Nice.
Yeah, I'll just add to that. I mean, you know, chatbots are interesting. I think of like the IVR systems back in the day. You know, I don't know how many of you have had experience with the chatbots. I know mine are usually not, and usually are kind of frustrating. But what's kind of next with chatbots from the research I've done is kind of more these personalized chatbots, where it has a little more information about me and is more intelligent than just the domain expertise that it's been programmed to deal with. With that then comes to the point of the question, you know, with the regulations, now it has more information about me that's being shared and could potentially be abused. So I would say, I would agree with everything you said, Luis. I would also add, there's definitely a healthy tension here around technology that can help, but it also can be used in an alternative way, you know, that we wouldn't want as patients. And so I think, unfortunately, there are people out there that want to turn these things kind of against us. And so I think that the regulations are good. To your point, they're going to follow technology. And we need to figure out ways to comply with the regulations, but also provide a good experience for the patients.
Okay, thanks, Neal. Thanks, Luis. And one question that relates to that. How do you see implementing gamification and other types of technologies on top of processes that are a bit rigid at the moment?
So again, with healthcare being a sensitive topic, kind of similar to the last question around, the regulations around it, certainly understand the question and the concerns and agree. Although gamification can sometimes ease the burden for the patient to communicate what's going on, especially when you're talking about mental disorders and things like that. So I think, again, it's a tool that can be used. It could be abused. And certainly needs to be thoughtful in how it's implemented, but it can be a tool for us as patients to communicate better with the providers, what's going on.
Right. Thanks, Neal. One other question that arose here is unrelated to how gamification and other technologies can help change user behavior. Could health scoring work to encourage health checkup and control on the patients?
I want to give a comment to that question, because there was another question that was very similar to that. And in many countries around the world, there are payers that basically pay you for using a smartwatch, right? So, and this is amazing. They lower your monthly payment just for, in order to force you to do the right things, like do a health checkup, go to the gym, eat well, and I believe it's working. It's amazing. I really don't know why every country in the world do the same thing. They with economic incentives, they're driving user behavior, and it's amazing.
Perfect. Thank you. Then we have one regarding HIPAA and security compliance. Considering HIPAA data security best practices, how do you innovate and create solutions that ensure patients' journeys are not tainted by data breach concerns?
Yeah, so HIPAA is the Privacy Act in the US that is to protect our data and how we can share data and things like that. So there definitely are, there's reasons, again, kind of Louis' comment, this was a reaction to the proliferation of electronic health records going out. There were things like HIEs, health information exchanges, that were popping up that were good, but the concerns, of course, and rightfully so, is who has access to that data and things like that. So HIPAA solves a problem and a real concern that we have around security, but it does also then challenge us in the technology world of how we can work within those regulations and then provide solutions like we were talking about that enhance the patient experience. Connecting, like in the interoperability aspect of it, connecting health records together to give providers more insight into our patient history and our patient journey. So again, I would just say there is definitely tension there. And the fact that we've had so many data breach issues from all kinds of technology companies, there's a healthy concern, and I think that's a reality that we need to address really as a technology industry better in security. And EMA, Europe, really trying to take the data security laws even further. We'll kind of see how that plays out, but it's causing some it's causing churn in the technology industry and how to handle privacy and security as a whole.
Good, thank you. I have one for you, Patrick. How much time do you estimate that is left for blockchain to be solid enough to take solid presence in healthcare?
I think that blockchain as blockchain with cryptocurrency and all the like of it may not stay around as big as it is right now for more than a few more years, although I could be completely wrong on that because Bitcoin seems to have lasted far longer than people thought it would. But I think the idea of a distributed ledger or private blockchain is what people are really starting to dig into now and starting to take advantage of to look and see if it's going to have a solid presence in healthcare. As I showed earlier, that group of healthcare providers and industry leaders are looking at blockchain for provider data And as one of the other question and answer sessions here has talked about, others are looking at blockchain for electronic medical records to have everyone would have a common electronic medical record. The concern over that, and the reason we're probably not going to see that anytime soon, is going to be people are going to need to test and validate the security of it to make sure that it can't be updated or deleted inappropriately. Well, blockchain is not going to be deleted because you'll know that it would, but it would not get updated inappropriately or access granted for it. So I think we're going to hear more about blockchain in the coming years, but I think it's going to be used in terms of words like distributed ledger, because blockchain and cryptocurrency, those things just have a negative aspect to it, a negative idea that people aren't as keen for that, but distributed ledgers they seem to be very happy with.
Great. Thank you, Patrick. And I have a last one. How do you deal with institutions that think data must be stored in servers that are physically placed inside the institution? And how does that work with the approach of having data and information in the cloud? How do you see things going?
So, I mean, the cloud obviously provides some huge advantages around automation and distribution of information through applications and so forth. So there's obviously, as we all know, there's a lot of advantages, but there's also risk in that, you know, you're providing, you have a third-party provider that has some involvement of the security. And so understand, you know, and have been in organizations to this day that are still concerned about leveraging the cloud for processing and storing of data. With that said, obviously, those same providers, the cloud providers, know that that's a challenge for the healthcare industry and others, you know, government agencies and other areas where there's significant concern around the security of the data, are going, I don't want to say out of their way, but understand that problem and are then creating cloud environments that are very secured and are really trying to work with the various industries that have these concerns and restrictions, working with these industries to provide a cloud environment that is secured. And just security, there's always going to be, you know, these vulnerabilities out there, right? I mean, there's just because it's hosted in some other, you know, my data center as a healthcare provider company, you know, they have to continuously monitor their security of their networks and everything. We see these vulnerabilities all the time. Cloud providers obviously have hired a lot of people to address that. So again, I think it's something that is a real concern for us. There's a lot of advantages. I think that's the direction where things are going, but it's going to take some more time for this security to continue to mature in the clouds and for companies to continue to embrace that as an option.
Sorry, I want to add something to Neal, because this is a question that I've addressed in many of the companies I worked before, and I would say to the people that have that concern is like, what are the odds of you having inside your company like better and brighter software or hardware engineers than what Amazon has, or I mean, Amazon keeps the data to the United States government. So what's more secure than that? So it's a matter of probability.
Yeah, agreed.
Awesome. Okay, that's all we have time for in the Q&A section. Thank you very much for your attention and involvement. And once again, thank you to our speakers for a great job and a very solid input. We appreciate everyone for taking the time to attend and staying tuned for upcoming seminars. Thank you.